So Bismillahirrahmanirrahim. We are going to start. And the first case is for Dr. Hiva. The screen is on. I think you know.
Yes, ma'am.
So take 2 minutes and then we will do it, inshallah. So we are going to do the first case, and the case is over the screen. We are taking 2 minutes. So after that, we will start, inshallah. Are you ready, Mr. Hiva? I mean, Dr. Hiva?
Yes.
Okay, so I will just stop sharing. I'll give you 8 minutes if needed. Extra 2 minutes I will give you, inshallah. So 3, 2, 1, start, please.
Hello, good evening.
Hello.
Hello, good evening.
Good evening.
My name is Dr. Wahid. I'm one of the doctors in the clinic. Am I talking to Mrs. Nora Miller, 30 years old?
Yes, doctor. I'm Mrs. Nora Miller. You can call me Mrs. Miller.
Okay, Mrs. Miller. We are here to talk about your health condition. Is it okay?
Yes, doctor.
Okay, Ms. Miller. Do you want someone else to be present with you?
No, doctor. I'm fine. You can talk with me.
Okay. Before we start our discussion, please tell me, what do you know so far about your condition so we can be
Okay. Please, in front of your microphone. So, yes, doctor. What happened for last 2 days? I'm really suffering a lot. I'm passing blood. I'm passing blood while I'm through my mouth, and also I'm passing through my back passage, doctor. And I'm really horrified. What is happening with me? And yesterday I came here. They have given me some fluid in my blood channels, and also 1 bag of blood they have given to me. Today morning, they did emergency uh, camera test actually, and also took the blood again. So I'm really afraid, doctor. What is happening with me? Why I'm passing this much blood? Am I having cancer, doctor?
Okay, Mrs. Miller, first of all, I'm very sorry that you have to go through all these things. I can see that you are very worried and very distressed. Yes, you told me all that you have been going through all these things and some emergency camera test first time. And we have the result of this camera test. And it shows something concerning.
So I'm having cancer, right, doctor? I knew it. Oh, my bad.
No, Miss Miller, please don't get so afraid. It's not cancer we are talking about, but there is something serious going on. There is some blood which is continuously oozing out from your gut. Okay, it is not something cancer, but it is something equally dangerous or harmful. Okay.
Okay. Doctor, how you are gonna stop it?
Yes, Ms. Kapila, we are here to discuss about the management plan, and we are going to sit and make a plan according to all your wishes. Okay, we are going to involve you at every step in this plan.
But doctor, I have a issue. I want to go to home now. Yesterday I was feeling like dizziness, but today I feel like I'm a little bit okay. I want to go home, doctor.
Okay, Ms. Miller. First of all, I want to tell you that you are feeling okay because you have been given fluids and you have received one bag of blood. So these things have temporarily been acting, and they are making you feel okay. And secondly, I want to ask that why do you want to go so uh,
Oh, doctor,
urgently?
your
Yes.
staff nurses are so bad. You know, they pricked me 3 times and they failed. I'm really horrified about these pricking things, about this needle. I have needle phobia. And again, they're just piercing me. What is this, doctor? You don't have an expert. I want to go home, doctor. I'm fine. I want to just go home. Please let me go home.
Smita, I'm so sorry that you have to undergo all through this, and I apologize on behalf of our nursing team and nursing staff also. And we can talk about that issue. Uh, I know that it has been very hurtful for you, but we can do something, Ms. Miller. What we can do is that I can talk to the nursing in charge, and she can herself take sample for, and she is very expert and experienced, and tell her about all that experience that you have to go through, and she will take extra care about that. How about that?
Then it's fine. So you are telling they will be expert and they can take the blood at a time, right?
Yes, yes, Ms. Miller. I will talk to our nursing in charge, and they can appoint a very senior nurse and very expert member. And if even that is not suitable for you, then what I can offer is that I myself can take the sample from you, and I will make sure that I will not hurt you, and I'll make sure to keep you comfortable. How is all that plans
Yeah, thank
sounding to you?
you so much for your concern, doctor. You are so kind, doctor. But still, I'm not feeling good here. Why don't you just let me go home, give me some medication?
uh, Ms. Miller, I can see that you are very upset about all this incident, and naturally, anyone would want to go home and don't stay in the hospital. But Ms. Miller, we want to keep observing you, and we want to make a plan for you. See, if you would allow me, let me explain it. Okay.
Okay.
So this is your card, and from here we did the camera test. We passed the tube from here, and then we visualize. We saw all these parts of the gut directly in the camera test, and in the camera test, the results show that this part of your gut is leaking blood continuously. Okay, are you getting?
Yes, doctor, I'm getting you. But
And
now I'm okay. So why don't you just let me go home with some medication to stop that bleeding? Because I'm fine now.
okay, yeah, that's what I was going to tell you, that you are feeling fine because some of the lost blood has been compensated by the blood bag we have given. Okay, but this blood is continuously leaking there in your body, and we don't have any medicine which we give you and you eat that and it will stop flowing of this blood from this breach which is in your, okay, and it will continue leaking, and as you earlier presented with blood through your vomiting through your mouth and through your back passage, it can happen again at any time. It may happen when you are driving back to your home, it may happen when you are alone at your home at any time, and we don't know how much of blood you may lose at your next episode. You may collapse at that time, and if you're alone, you may collapse and sustain any injury,
Okay.
and it can get very bad. And I'm worried for the next time what might happen if you have to go through all that. Are you
Oh,
getting me?
yes, doctor. Now I feel that it is necessary to stay over here. Uh, okay, doctor. Then I will stay, doctor.
Okay, Ms. Miller, that's very good that you are understanding all this. We are going to make a team of doctors, and they will review your test, and they are going to make a plan that what we are going to do further to stop this leaking of. There can be many ways. There
I'm
can
finished.
be
Continue. Yes.
there can be many ways, and the treating team will best decide that which is better, which is best suitable. Okay, sometimes they just clip that vessel which is oozing blood, and they tie it, and they by a procedure just like an endoscopy by camera, which you have gone through previously. Okay, or they can be other ways also, and the treating team will best decide that which is the best way. Okay.
Got it.
Meanwhile, we are going to keep you in hospital to keep observing with you that your blood counts may not drop dangerously. Okay, so we can keep an eye on you. We will keep an eye on your blood pressure and your heart rate. Okay,
Okay, doctor. I got it. Okay. Thank you, doctor, for your time. Time finish. Okay. Thank you, Dr.
thank you.
Hiba. Thank you. It was very nice, very empathetic and not empathetic, I should tell, sympathetic and very nicely done. Mashallah. Okay. So let's just first of all, and you covered all the issues. Let's start from the first. So this is Dhamma, like the last classes we have done, right? That discharge against the medical advice. I told you that if patient want to go, you need to ask why till he's getting agreed. If not agreed, then you can make the last option is to arrange for a consultant meeting with a consultant. Maybe he will be in a better position to explain it to you. This is the last resort. But till she is not agreed, you need to ask her why, and every problem you need to give her solution, like Dr. Hiba given me. Okay, so let's start from the first. So what she did, she already just a minute, I will write over here. So this is our number 21, right? So yes, you introduction was good, obviously, and then you ask for the third person if I want or not. That one also done very nicely. You take the permission, then third person, and then also last you asked me about my situation, so I explain it to you. You did it very well, and then I told you that actually what happened. Then you breaking the bad news because I told you that I don't know what is the result. Okay, but in the same scenario, if the patient is already telling that I know there is a bleeding point is there, already endoscopy result, I know that camera test result already I know, and I also know the blood count. So, but I want to go home. From this stage also this can be started. This is recent case. I think this is from so the Jeddah case. So any from anywhere they can start with. Okay. So it depends on how the surrogate was instructed. Okay. So I told that I don't know. So you started with breaking bad news. So it became two things together, breaking bad news and also Dhamma. So you need to cover both the issues. Okay. So you did it. You have broken to me the bad news. You take the golden silence very well. Okay. That what I'm having. Then you told that then I busted out that no, I want to go home. Then this is the part I started with Dhamma. Okay. Because the first part you did it. Then I told, no, I want to go home because I'm now fine. So you did it very well, explained that why I'm feeling fine right now. Because already the fluid I have lost, the blood I have lost, it is compensated by the given fluid through my blood channel and also one bag of blood. So that's why the dizziness and it's like temporarily it's already healed. I'm feeling like I'm feeling well, but it's not true. But whenever if you go home there is still the bleeding point is there. So our treating team will decide what to do and we will keep you in observation because anytime this blood count can drop more And maybe it will, if blood count is dropping more, that means ultimately your oxygen supply to different part of your body, it will be low, and you can collapse, even it can threaten to your life. So this is the complication. Explain it to me that if I want to go, then this happened. Then I told you, no, no, I want to go. And she asked me why. Because of that pricking problem, that needle phobia, and they missed it so many times. And she did it very well, that this is not an error, obviously. She can only be sorry. That's it. So there is no apologizing. It can happen. It can happen with any patient. Okay. So you can say sorry, and then also give her hope that next time how we are going to do, maybe some expert or sister in charge who are in very expert, we will arrange them to do the next time so that it will not be missed on your next time. So she did it. Okay. Then here other issues I didn't arise. It could be same like I told you, that it could be that the food is not good, or I don't like the cabin. There are so many people around me. It's so much crowded. So last time we have discussed this all the things. So I didn't give her this one. Okay. So this is the thing. And then I agreed. Right. Then I told that still, even after this one, I told, no, no, I want to go home. Then she explained me the complication, that if you want to go home, then this can happen. So I got afraid and I'm agreed. And this surrogate was also instructed to get agreed. She was agreed also. So this is the thing. And the clinical judgment is also important. She mentioned about this one, that even if it is not mentioned that what next time, what it can be done, but she mentioned that anything can be happen, maybe clipping. So I mean, we don't know, the treating team will decide. This is your clinical judgment. That's next time maybe another camera test needed to stop it. Okay. So this is the clinical judgment. Okay. So this one she did. And the team of doctor, I mean the multidisciplinary doctor also she involved. So very, very nice. You didn't miss any point at all. Very nicely done. Thank you. Any question from this scenario? This drama case actually last time we discussed, so I hope there is no other question, but it can be. Any other question from here? Any question, dear? Okay.
Oh my.
Okay. Yes? Anyone? If no other question, can we go to the next case? Next case was Dr. Moazem. Are you there?
Yes, ma'am. Yes, ma'am.
So this one is your case. Take 2
Okay.
minutes, inshallah, and then we will start. Okay. Shall we start?
Yes, ma'am.
So, stop sharing.
Hello.
Yeah. Hello.
This is Dr. Ahmed here, one of Dr. Medicine in the medicine department. Am I talking to Miss Maha Noha, 39 years?
Yes, doctor, I am.
Okay. How do you want to be called as Miss Noha, as the notes say? So,
Mrs.
Miss
Maha.
Noha,
You can call me Mrs. Maha.
yeah, Miss Maha, sorry, Miss
Yeah.
Maha. Miss Maha, we are going to discuss something related to your health condition. Are you
Okay.
aware of it?
Yeah. Okay, doctor. Go on.
Do you want someone to be around us so that they can join you in discussion?
No, doctor. It's okay. I can manage.
Okay, so Miss Maha, to be on the same page, uh, would you like to tell me what you have, what is your prior knowledge about your health condition?
Oh, actually, doctor, I don't know. I am having actually yesterday before one day, your consultant has told me that I'm having gut cancer, and I'm very much depressed, doctor. And I don't know that how long I'm gonna live my life, and I'm so young to die, right, doctor?
Well, Miss Maha, I can understand your concerns and worries. The, anybody in your place would have the same. Uh, and
So
I can,
so that I can live a little more, maybe some few years more. What's your plan, doctor?
Ms. Maha, based on the information that you have, our team, our specialist team had a meeting, and they came to a conclusion that they will, since, as you are aware of it, the cancer has spread to certain limits. But given the fact that we have an expert treating team, and our team comprises of various kind of experts and specialists dealing with your cancer, um, they have decided to resort to a treatment called palliative treatment. Have you heard of it?
No, doctor. What is that? So I'm seeing some ray of hope.
Yes, exactly. I can put it that way. You're right about it. Uh, this is a kind of therapy or a treatment where they try to improve the quality of your life, controlling the spread.
Okay.
Are you getting me?
Yes, yes, I can understand.
Yes. So the focus is actually on keeping the quality of life maintained and making sure that the symptoms are not bothering you. Now, does it sound okay, Miss Maha?
Okay, so you are telling you are not going to treat my cancer.
Unfortunately, Miss Maha, since it's in stage 3,
Hmm.
so the curative therapy is not possible. What we can do a protective therapy, and
Okay.
it has got 2 phases. One is surgery, one we call chemo. Are you with me?
Yes, doctor, but I have heard this chemo is having so many side effects, doctor. Was one of my
Yeah.
friend she was taking, and
Mhm.
she lost all of her hair, and she's looking really ugly, doctor. Already I'm gonna be die. I don't want to look ugly, doctor. I don't want to die ugly.
Ms. Maha, I can appreciate your concerns, and they are rightly placed. But we assure you that our treating team will uh, manage the dosing to an extent where we will be controlling the aggression of the cancer. We will not be giving you an overly aggressive dose to you that will make you, as you mentioned, that as you have seen with your friend, maybe you would have seen her hair falling off or something like that. We will make sure that we will maintain it to an extent where we will be able to put a break on the spread of cancer. Are you with me?
Okay, so you are telling I'm not gonna lose my hair?
Um, I can't assure you that. There's a likelihood we will keep it to a dose and an extent where we'll make sure that we are just controlling the spread of it, since we are unable to cure it completely, as I have told you before, Ms. Maha.
Okay, doctor. So I
I
will.
know I'm causing concerns with my talk, but this is something which I have to tell you so that I give you a clear point of view of what our treating team thinks.
Okay, so maybe there are also so many side effects, doctor. What are the other side effects of chemo?
Well, it varies from person to person, but most of the times there's a failure, some of the cell counts, some of the cells in your blood, they decrease, but we will keeping a check on it. We'll be we'll be doing periodical tests. We'll be running periodical tests on your blood to make sure that we are not aggressively controlling or aggressively treating your or aggressively controlling your cancers.
Okay, okay, doctor. I got it. And what about surgery, doctor? There will be side
Yes.
effects, right?
Mhm. Well, it is as I have mentioned before. It's not a curative thing.
Mm-hmm.
We'll be making sure to do the surgery to extend so that we protect the bowel function. Are you with me?
Yes. I got it. But
So we will
doctor,
be doing.
actually in Google, I have read about one new therapy. They're telling immunotherapy. Why don't you give it to me, the immunotherapy?
Well, it matters. It depends on case to case. In your case, the treating team, Ms. Maha, has decided to resort to surgery and chemo as a palliative. But we assure you that we are updated in terms of dealing with your case, and we will be making sure that we give you further information through brochures or any other videos that will make it easy for you so that you can digest the whole information easily.
Okay. But they told I have read in Google that it's so advanced therapy. So why don't you tell your consultant to please just give it to me, save me, doctor?
Ms. Maha, in your case, if you are talking about immunotherapy, it's a grade 3, it's a stage 3. So it has crossed certain limits. And I'm sorry to break it to you, the immunotherapy in such cases doesn't give us the results that we require it to give us.
Oh no, so I'm beyond of any kind of treatment actually.
We haven't denied any kind of treatment to you, Ms. Maha, but we assure you that the treatment we are giving under the umbrella of palliative is going to make sure that you live a balanced life and your quality of life is maintained and not impaired.
Okay,
And
okay,
rest assured, we will try to create a bridge between you and the MDT and the specialist team of doctors as well. If you have any other concerns, we can escalate to them as well. But as of now, the things that I'm breaking to you are these:
okay,
palliative therapy, we'll be using two wings of it, surgery and chemotherapy.
okay. So doctor, if I'm having any kind of okay, time finish. Just one more concern. So if doctor, I'm having any pain during this palliative treatment you are telling, will you give me painkiller, doctor?
Yes, we have specialist palliative nurses, Ms. Ma, and we will keep sure, as I told you, that our focus will be to maintain the quality of your life, which also includes controlling the pain, which is an essential element of cancer. Comes with the cancer. So we will be making sure that we will keeping the pain control and in check.
Okay, doctor. And last question, doctor. How long can you give me a time frame that how long am I gonna leave? So I have some issues
Uh,
to finish with my
mhm.
babies, I mean my kids regarding property. So I want to know, doctor, how long am I gonna live?
Uh, I can understand that you have concerns related to your baby. We will try to seek help of social care team as well, but I cannot break it to you in a way where I can give you a clear time frame because every person responds differently. So based on months or giving exact number of months and years, I'll be unfortunately unable to give you any clear-cut information. I understand your worries and concerns. We will involve relevant teams of social care services We'll be doing our best to involve your relatives and family as well, maybe to seek their help in that regard. I cannot give you exact time frame, Ms. Maha.
Okay, doctor. Okay. Thank you. Okay. Thank you, doctor, for your time. Thank you, Dr. Muazzam. Very nicely done. So let us start. So this one also, I think Jeddah case, another one, and also some other centers also, this first that it came. So that's what I'm telling, that usually these are repeating actually. So most of the cases, if you find that if 2 or 3 last diet cases you are doing, then there is more than 80% chance that you will have common cases. Okay, like it's not like the same case, but it's like similar case. Okay, if like DAMA, you can do any DAMA, discharge against medical advice, right? If breaking bad news, if you know the diseases, you will do it. If palliative care, if you know the theme, you can do it with any cancer. This is colon cancer. If it is some another other cancer, if it's the same, like already metastasized, and they have decided to go for the palliative care, the theme is same, the structure is same. You just have to put all the things according to that name of the disease they have given you. Okay. So yes, the introductions. Let me first of all start screening. So this was our second case, and Dr. Muazzam did it very well. Mashallah, applause. So first of all, the introduction, and please don't get confused with the name. As I told you, if you are confused somehow, just ask the name. May I confirm your name and age, so that you can be more confirmed. Okay. So you give your introduction, and then you ask me, what about this one? Okay. I will share, inshallah, Dr. Malik, in our group. Don't worry, in our group, all the cases, the first, second, third, all the cases, screenshot I will share after this. So don't worry. So let's come back to this one. So after that, you have broken the news. I have already told you, because I am so much worried and I'm so depressed. Yesterday, I got the news that I have cancer. Obviously, devastated news. So now I want some hope that what actually your plan. So yes, you told that MDT meeting. Actually, they are telling that there will be a meeting. So I don't know the exact scenario what it was, but if it is written, whatever it is written, try to read. If it is, there will be a team, and maybe the consultant has told you to just discuss that. It could be the options. Maybe they will discuss in the next week. So it's not already discussed. So the lines are very important to read it out. Okay. So anyhow, whatever the scenario is telling, that is the truth. Okay. So here, what I have written, that the MDT team actually still they haven't hold the meeting, but consultant has already told that maybe in the next meeting they will discuss about her treatment option, and we are giving her the idea about what could be the treating option. Okay. Yes, it's okay, doctor. So that's why reading, that is our thing. No? We are learning from here that if there is any line that it will be done, it is already not done, be careful about that one. Okay. So here the consultant has told that, okay, just discuss about what is palliative care. So she will have some idea and she will get ready, and next meeting they will discuss and they will take the decision. Okay, like that. So chemotherapy, regarding chemotherapy and surgery, this is your two term, and you were very, very, nicely done. And not only that, you told the exact thing what is needed. That some people, they do it in a wrong way, that if it is like a surgery, they're thinking that the surgery is different, but no, they told this surgery and chemo, this chemo and surgery, whatever it is, it can be under the palliative care. So surgical, like if sometimes like here maybe colon cancer, the part it's need to be removed, they will remove it, but it's not like they can remove all the other area where it has already been spreaded. Okay, but they will remove the part, maybe it will not spread it more, or maybe to make the bowel clear. So this surgery, it is not as other part of the curative treatment. This is a part of palliative care, what Dr. Muazzam have mentioned very clearly, that these both are under the umbrella of palliative care. This is the thing they want to hear, that do you have a clear idea about this or not? This is your clinical judgment that if you have this clear idea or not. Any surgery, there are also another case, recent diet case. That one is the gallbladder, CBD, common bile duct stone and common bile duct cholangiocarcinoma. That one also they will do a surgical procedure to make that ERCP, through ERCP, to make just push away the cancer, make a place so that the bile can be, the discharge from that gallbladder, it can drain easily, so that the itching, maybe it will help you to low down the yellowish coloration of your skin. This is the other case I'm telling, okay? Cholangiocarcinoma or CBD stone, this type of thing. So that one was also part of the palliative treatment. And the exact thing, what they're searching for in the whole scenario, that if you are telling her that this surgery, actually, we are not going to cure you. We are doing it to make you comfortable, to make you it is a supportive treatment, and it is actually a part of palliative treatment. It is must to mention that this will be done as a part of palliative treatment. They want to hear it. Other than that, so many people, they are getting the feedback that they didn't mention that this is a part of the palliative treatment. This is the important things. This is the place you may lose the mark. Okay. So here also same, that surgery is the part of the treatment. The next thing is that you need to tell about the chemo and surgery, what could be the side effect. Okay. So the side effect chemo, whenever any surgical procedure or any treatment option we are giving, we need to tell them about the side effect also. So chemo side effect, at least already I told you that I'm afraid of chemo. I have heard and I have seen that my friend have lost hair. That means I want some solution from there. And actually, usually after chemo, the hair fall, you cannot stop it. But you can tell her that it is reversible. Maybe after stopping of chemo, you will get it back. Okay, this is one solution. Another solution, and still nowadays it is so advanced in our cosmetic department, you can use some wigs also, so that you will not look ugly. So give her some solution. I'm worried that I will die looking ugly whenever I go outside. People will look at me, I'm an ugly looking woman, and usually women don't want that, right? So this is your solution. So solution should be very clear that it is reversible. After that chemo, it may grow back, some hairs may grow back. In the meantime, you can use some wigs. There are so many very the artificial ones also looking like so real, even most of the people cannot make it differentiate that if it is real or not, so you will not look ugly. Okay, so this is your first question's answer. The second question I told you, is there any other side effect or not? So in that case, you mentioned about that actually immunosuppressed, right? The blood cells, because of bone marrow suppression, it could be. So the layman term of, obviously we need to use that, yes, the blood count of your body, it could be maybe low down, and your defense mechanism of your body may low down. You may have some infection, but don't worry. At the same time, solution. You told the one problem and you told the solution. So what is the solution? We will give you, whenever if there is any kind of infection, we are going to treat it with appropriate antibiotic. So don't worry, we are going to follow you up throughout your journey. Okay, so this one is your another side effect. Is there any other side effect? Some side effect, importantly for chemo, they want to hear actually some specific number actually they are carrying. Okay, so chemo side effect, the hair loss is important to mention. The side effect of this defense mechanism or the number of the cell, it is coming down. This is also important. Then important is that, very important, that was about infertility also. Because they have, if you are not telling them, maybe if they have some hidden issue, they will not ask you. Okay, so it is also, you need to tell that yes, it can cause problem with getting babies. So that time they will ask, oh no, doctor, there will be a hidden issue. They will ask, as you didn't mention me about infertility, I didn't ask you the concern. So you lose that concern. Okay, so this is the thing. The infertility is important, hair fall is important, defensive system, even some feeling of sickness or nausea, that one also you can mention. But don't worry, we will give you appropriate medication to stop it. So don't worry. These three very, very important because they have questions. They have hidden agenda. They will tell you that I don't want to look ugly with hair loss. They will tell you, doctor, if I'm having infection, what you will do? They will tell you infertility. If what you are telling, doctor, I thought that before dying, maybe I will have a kid. I will gift a kid to my husband. Okay, so there are some hidden issues with the side effects. So chemotherapy, these 3 or 4, sometimes nausea also they want to hear. So these 4, please try to mention. Even if in one line, maybe some hair loss, some feeling sickness, some defense mechanism may be low, maybe you will have a problem with getting pregnant. So these things at the same time, please try to tell her. Okay, so these are the side effects of your chemo. So, and give her solution with each and every one. This is the thing, because they have hidden agenda. After you mention, they will give you. Surgery also, as they have mentioned, surgery also at least 2 to 3 side effects, like same. There could be infection, there could be injury to the surrounding organ, there could be bleeding, but don't worry, we have a very expert team. If it's decided to get with under surgery, please be sure it will be done under our very expert team who has done it many times before. So don't worry at all. This is the thing. Okay. And the starting, actually chemotherapy, regarding chemo, you need to, okay. Regarding fertility, the solution, very good question. Regarding fertility, you need to tell that we will involve our specialized team. Okay. And there will be, in case if female, then you can tell that if you want baby, maybe we can go for in vitro fertilization. I mean, you can have baby in a specific procedure. So IVF, in vitro fertilization, you need to tell to the female. If male, you need to tell that you can preserve your sperm before starting of chemo in the sperm bank so that you can use it later on for getting a baby. So sperm bank for the male. So these are the solution. Okay. So infertility, variably they are asking. Okay. So if male, you will tell we will preserve the sperm in the sperm bank. If female, we will arrange a specific procedure through which you can have baby. That is in vitro fertilization. Will involve our lady doctor on a specialized team. They will be and we will have a meeting with them, and you will have more idea about this procedure. So she will be relaxed. So give her solution. Okay. So these are the side effects. Okay. Starting of the chemo, what is chemo? He told Dr. Mozam, explained it well, that actually this is a very advanced procedure, right? It's very advanced. I mean, your cancer is so advanced already. It has spread to different organs, and it is in the stage 3. And I'm sorry to tell you, this procedure, this is a holistic type of procedure where we are going to give you treatment to heal or treat the symptoms that you will have. But I'm sorry to tell you, I'm sorry to inform you, we are not going to give this treatment to cure the cancer itself. So giving it a clear picture that we are not gonna cure it is not in our hand. Okay, just we are going to give some symptomatic relief so that you can lead a very good, you can lead a comfortable life. Your quality of life will be improved. Okay. And MDT team also, if you can mention that we have already here, we mentioned that MDT team, they have one. So we have already a group of specialists. So here you need to mention that there will be a palliative care doctor. Okay. There will be a palliative care doctor and Macmillan nurse. So Macmillan nurse, or even if you are telling that there will be specialist staff nurse, that is also okay. Macmillan nurse usually who are dealing with the cancer patient, okay, cancer patient. So Macmillan nurse, you can involve the social worker. Here MDT team is important actually. When cancer you have involved, we have already a group of specialists to make assured that we already have a team who are gonna take care of it, and they are going to have this meeting next week. So what is this team contain? they have this palliative care specialist. We have our Macmillan nurse, social worker, SALT team if needed. What is SALT team? Speech and language therapist. Here, no need. But if it is a stroke or the patient cannot swallow, this type of patient, this team, what they are doing, they are giving solution if there is any problem with swallowing or any talking problem. Okay, if there is any problem with the swallowing or if there is problem with the talking, then the SALT team is come handy. You will involve the SALT team. Other than that, no need. Like stroke patient, you will involve. MND patient involved. Okay, if already bulbar involvement. Okay, so this SALT team only that time you can involve. So it's not under palliative only. It can be any other places. Any stroke patient must, if they have told you that dysphagia is there, must. If you are not including this SALT team, you are going to lose the mark. Okay, so this MDT team finish chemo, the explanation what is chemo, then MDT team, and then ultimately, as we discussed, that the part of the surgery and chemo and discuss about the surgery and chemo. That's it. You have done your task properly. Okay. I have asked the last question just to make him confused, and he was not confused. He was confident enough. Confidently answered me the right answer. That can I have the painkiller? Yes. Yes. Here, painkiller they can give. If needed IV fluid, they will give through blood channels. Anything if needed, they can give. No problem. Okay. If any IV fluid, if any oxygen, if any kind of painkiller, okay, everything. They will take care. This team will take care of what? Like if you are having any pain, we are going to remove that pain. We are going to give you painkiller. If you are having any kind of infection, we are going to treat it. If you are going to rise of temperature, we will lower it down. Okay, so don't worry. Every symptoms, whatever you are suffering in future, we are going to treat it. And this is our palliative treatment. Okay, why did I ask you? Because usually through the next case I will discuss actually the EOL, the difference between the end of life care and palliative care. Okay, there through blood channels you cannot give anything, any invasive procedure. No for end of life care. So okay, Dr. Pulkit is asking something. What if patients say he's addicted to painkiller? Then what should we tell, ma'am? He's addicted to painkiller. Okay, so it's about here. Painkiller is not because you will give ultimately painkiller because you have to go to the morphine and everything, right? Here it's not about the bleeding ulcer or anything. If it is bleeding ulcer case, like the previous case, okay, if the patient mentioned that I'm taking some painkillers, what is the cause, doctor? I'm having this bleeding. Okay, this could be another question from the 21. Very good question. This could be question that, doctor, why I'm having this bleeding, that oozing you are telling in my gut, there are some bleeding point you told, why I'm having this? There could be so many reasons. Sometimes because of some medication like painkiller, it can have. Sometimes because of you are not taking proper timely food, you are not leading a normal life. That time maybe the patient will tell, oh doctor, really I'm addicted, like you are telling. Yes, I'm addicted to painkiller, I'm telling it. That time your clinical judgment, then you need to stop it. This is your clinical judgment. In this case, this 21 number. Okay, here you need to stop it because this is a duodenal ulcer and she told you she's taking a painkiller and you are not stopping it. You will miss your number in clinical judgment. Okay, very good question, Dr. Pulkit. But in the next case, the 22, here already, even if they are telling I'm already addicted to painkiller, okay, in that case, we will review it. But be sure that we will give you a pain-free environment. Okay, let him be assured that it's not like he need to stop. Actually, he will need painkiller, right? Any cancer patient already spread it. You cannot keep him in pain. Okay. Okay, Dr. Malik, how to approach DAMA? DAMA, actually, we discussed there the same, like the last class. The same here already we discussed. The same questions were there. Okay. Okay, now here chemo surgery I told and everything. And yes, excellent, Dr. Mozam. Thank you so much. You did very well. And now,
Thank you, ma'am, for giving me case and correcting me. Thank you, ma'am.
no, Alhamdulillah. We all are making mistakes. Even if you give me now, I will do some mistakes. It is always if we are doing, and that's how we are learning, right? But you did well, Alhamdulillah. Okay. So now the number, any question from here, palliative treatment, before we just jump to the next case, because that will not be palliative care. Any questions from here? Any
Ma'am,
questions?
so,
Yes.
ma'am, according to you, so my response to the pain thing would be that we will be giving you pain-free environment and not painkillers?
Yeah, a pain-free environment. We are going to give you painkiller. Painkiller also, it is not a jargon. I mean, the
Okay.
word choosing, you can choose any word. Okay, it is okay. Painkiller is not a jargon. That one also you can tell. It is okay. Anything
Ma'am,
else?
I have a question.
Yes, please.
So the patient asked that how long do I have? How
Yes.
exactly to answer that question?
Yes. And this question usually, if palliative, I mean cancer patient, if they have time, this is always a hidden agenda. You will get it if this one. So he answered it very nicely. Actually, this is, as I'm sorry that it has already spread it to different organ and cancer shortens life. I'm sorry to inform you, but I cannot give you the exact time period. It could be because different people respond to the treatment differently. Their body responding to that treatment differently. It could be from months to, I mean, weeks to months, but not more than months. Oh, I mean, not better not to mention years, because already which is spread it. Better not to mention years, because months you are whenever you are mentioning, that means she will have hope for years. So if already spread it, better up to months you I mean, stop. You can tell like that from weeks to months, from days to months, but don't tell better 2 years. Thanks for asking. Thanks for asking. Dear. Very nice question. Okay. So here, because already metastasized, and usually metastasized patient 1 year, it is very, very uncommon. I mean, not uncommon, very luckily if they are surviving. So even months will cover years, 1 year, 2 year, even 24 months. So months, it is a very safe I mean, word to express and to give them. So give him a range like months. It might be from days to months, but I cannot give you exact time limit. But please be sure you have given the very very devastating news, very bad news that you are going to live only few months. Please, at the same time, please be sure. Please be sure our whole team will be with you to support you during this period. We are not going to leave you alone. Give us support. Okay, so whenever any question, this type of sad news you are bringing, try to put some hope or support that we are here. You don't think you are alone in this journey. Okay, that's it. That is the way, so that they will understand that you are not only safe doctor, also you are sympathetic. Okay, so your gesture is, it is the kind gesture that we are here to support her. Okay, is there any other question? Any other question? If not, that we will jump to the number 23. So today, this is our third and last case, inshallah. I think Dr. Malik, you want to take now? Are you there, Dr. Malik Usama? Yes. So 2 minutes for you. Just a minute. I think somebody asked me for our group. I think groups link. This is the group link here. Okay, in the chat box I have given. So this is our third case for today. Inshallah, we will do it. Take 2 minutes, Dr. Malik, and we will start, inshallah.
It's 39 or 69 years.
You cannot see?
Age.
Okay. 69. Nora Maha, 69 years old. Here it is written. Here, 69. Okay, 69. One important thing I missed to tell you about that. This one. What is the we are telling that advanced directive also here important because already metastasized. So here you guys need to mention about this advanced directive also. Okay, we'll discuss inshallah after this case. So this was also very important. Any cancer patient already metastasized going to die, please don't miss that. Even if you have few seconds, just mention that we are going to discuss about it. I'll discuss inshallah. That was also hidden agenda. Okay.
Yeah, you can start.
Okay, just a minute. I will give you time. Eight minutes. We are going to give you. 3, 2, 1. Start, please. Yes, you can start.
Hello.
Hello.
I'm the officer in this general medicine department.
I think your voice is cracking, doctor. Is it only me or others also getting the cracking bad voice? Can you talk again, please?
Hello.
Yeah, your voice a little bit harsh. Your voice is breaking, dear. Your network, I think. Yeah, tell me again. We will give extra
Now
one.
it's fine.
Yeah, now it's fine.
Hello.
Hello.
Hello. My name is Sama. I'm one of the medical officer in this general medicine department. May I confirm your name and your relationship to Mrs. Nora Maha, 16 years old?
Yes, doctor. I'm her daughter. I'm Mrs. Samira.
Okay. Are you the next of kin, Miss Samira?
Yes, doctor. I'm her next of kin. You can talk
Okay.
with
To
me.
be on the, yeah, to be on the same page, may I know how far you know about your mother's condition?
Doctor, actually it should be 69. I'm sorry. Here it should be 60. Yes, my mother, she's very old. And she has recently been diagnosed with colon cancer. And they told that it has already spreaded to different part of the body, doctor. And they have started chemo, and now for the last 1 month, she is taking chemo. But I don't know, doctor. She's not improving at all. Rather, I feel like that we are losing her. She's getting worsening day by day. What's happening with her, doctor?
Thank you for sharing this information. And I appreciate your concern, and it must be very stressful for you.
Yes, doctor. I'm so stressed.
Yeah, and your mother condition is deteriorating day by day, and our treating team has decided something for you, and I would like to share that with you.
Yes, doctor. Why actually she is the why don't you change the treatment? I think this chemo is not working for her. Give her something very strong.
I appreciate your concern, Miss Samira. Actually, this chemotherapy, this cancer killing medication, also has some of its bad effects, and also your mother's colon cancer, gut cancer has like spread to different parts of the body. So, putting all these things in mind, our treating team has decided for end of life care. Have you any idea about that?
No, doctor. What's that? End of life care?
Okay, I will explain it to you before that. So, our treating team has also decided that we won't be doing any more chemotherapy sessions. Like, we will be stopping this cancer killing medications,
So,
and we
so
will be
giving another treatment, right? End of life care. What is that?
no, Mrs. Samira, it isn't like that. We won't be as your mother's condition is deteriorating day by day, so we won't be doing any heroic measures or giving her any medications.
What?
Like,
What are you telling? So you are letting her die?
unfortunately, Mrs. Samira, we will we won't be giving her any medications or anything through blood channels right now, as her condition is very critical and he is deteriorating day by day.
Uh, so you are not, you are letting her die. So give, but she's so much agitated, doctor. So give her medication. Give her some medication.
Yeah,
Aggressive.
so like we will be stopping this cancer killing medications, and if she feels like agitated, so we will give her medications through the skin to calm her down. And if she has like this feeling sick, so we may give her anti-sickness medication through skin. We
Okay.
only will be doing that supportive treatment. Yeah.
Okay, I got it. But if I mean, if what about her eating, doctor? You are, if you are going to put her on tube away, how she's going to eat?
I appreciate your concern, Mrs. Samira,
Give her some
regarding.
tube through the mouth or nose, because I have seen people who are not taking food because she is not nowadays not taking any food. You can see her; she is losing so much weight. She's like skeleton, doctor. Give her some tube feeding.
Yeah, so Mrs. Samira, regarding this tube feeding, we won't be doing it in end of life care. You can only give sips of water or something through mouth, but we won't be doing any tube feeding in her case. I'm sorry to tell you that.
Why, doctor? Why you are not going to give?
Mrs. Samira, I understand your concern, but it won't be any beneficial, as your mother is very critical right now. Okay, and this tube feeding, it has also its own bad effects, and we won't want that for your mother. Okay, though
Oh,
you can give her some sips of water. All right.
oh, okay, doctor. I get it. I really think that you guys are letting her die in this way. This is so pathetic, doctor. I cannot bear the pain.
Yeah, Mrs. Samira, it must be very difficult for you right now, and we will be doing our best to help her out. We are only currently withdrawing like for tube feeding and but cancer killing medications. But if she has any, if she feels like agitated or she has breathing difficulty or she is feeling sick, so we will give her medications for that through her skin. Okay?
Okay, doctor. Okay, you have 1 minute left.
Do you have any other concerns for me?
No, doctor. What? Okay, so how long she's going to leave, doctor? What do you think? How many
As
days?
her as as her condition is very critical, I won't give you any exact estimate, but it will be like in days, 2 weeks, Mrs. Samira.
Oh no, this is so disheartening, doctor.
Yeah, Mrs. Samira, that's true. And has your mother made any wish in case she is unable to decide for herself how to be her how she should be cared in her last days?
Yes, doctor. Yes, she made her will.
So can you please share?
Yes,
Has she?
doctor. She has nominated me actually.
Okay.
Okay. Time finish?
Do you have any other concerns?
No, doctor. No, thank you. Thank you so much. Okay. Very nice. Very nice. You did excellent. So let's share first and then we are going to discuss, inshallah. Just a minute. Okay. So the difference between the, uh, just a minute, because I have shared, I think you guys have already seen this one. this picture I want to show you guys. This one is, you can see this outer portion, this is palliative care. That means under palliative care, the end of life care, terminal care, this is inside this bigger umbrella. This is the biggest umbrella. This is a big area. Okay. Inside that, once it's like here it is written weeks to months, but he's right, Dr. Malik Usama, he's right that better not to mention weeks to months in end of life care, better days to weeks. But if palliative, that time weeks to months, it is better. Okay, so if palliative, you will tell weeks to months. If end of life care, you will tell days to weeks. Okay, keep marking like this. This should be some memorizing things and key points you will never forget. Okay, and at the same time, I cannot give you exact day timing, but be sure we are here with her to support her in every days. Okay, every last days of her, of her life. Okay, the last one is the terminal care. Terminal care, we don't have any cases. Usually, they are having case either from palliative care or end of life care. Okay, now one by one. So, first of all, regarding this palliative care, end of life care, that you need to tell, as Dr. Malik, she mentioned that we are going to, because it was in the scenario that we are going to stop the chemo. Already it was done. It was going maybe as a part of palliative care. So now it is mentioned in the scenario that it will be stopped. So obviously, whatever the scenario told, you need to mention. You need to inform the daughter. So first he introduced himself very nicely and he confirmed regarding that if I am the next of kin or not. This is very important thing. You can ask directly like he asked that are you the next of kin, or in the other way also you can tell I assume that you are next of kin to the patient. Both are correct. Both are correct. But you need to mention that you know that next of kin asking, because you cannot share any news. This is like the personal things, right? It is the right of the patient that will she be tell it to other people or not. So the secrecy, the confidentiality, you need to maintain for any patient. So you need to mention, be sure, confirm that actually she's the next of kin and you can discuss the issues with her. So any third person, not only in this case, okay, any third person, if third person is there, they're telling to talk with, not to the directly to the patient, please be confirm it that yes, she or he is the next of kin and he did it. Okay, so this is the first thing that he did. Then he wanted to they asked me what I know. Then I told her that actually she's deteriorating because actually chemo is not supporting her, right? So that's why now he gave me the bad news that we are going for another option, that is the end of life care. Now explaining the end of life care could be a little bit better. I mean, it's okay, but we are going to stop everything. But so what you are doing, you are going to do nothing. But here at least two words. Always try, as I told you, that some key points, just like memorization, try to memorize it. Okay, both holistic pathway, if you use this word in palliative or in palliative or in end of life care, both are actually holistic pathway. Here, end of life care, our motto is to keep the patient as comfortable as possible. As comfortable as possible. Okay, and maintain the quality of life. These things you can use in both, in palliative and in end of life care. The difference in palliative care, you will mention that we are not going to cure, where we are going to give the treatment to support her symptoms, but not to cure the cancer itself. That one you need to mention. So this is the starting. So it's a holistic pathway. So it's in which we will make your mother's life as comfortable as possible. And obviously we will make sure that the quality of life will be maintained. So these two keywords, please just memorize so that it will be the tip of your tongue. Now coming Here, we are not giving any aggressive or invasive procedure, no aggressive procedure, no invasive procedure, no intervention. We are not going to do any intervention. Okay, so you are not going to do any blood channel, no IV, no antibiotic, no ventilation, no catheter, no cannula, anything that you are going to prick her, we are not going to do in EOL. Just remember this. Okay, so nothing invasive you cannot do. So what you can give her here? You can give her 4 things, but that will not be with feeding. No tube feeding. Yes, very good. No tube feeding. Anything that is going through inside her body, you cannot give. But yes, for some dermal patch, you can give. Okay. So here, what you can give? You can give PACES. PASS. These 4 symptoms you can treat. What is this? If there is any pain, we are going to give her some pain medication over. Okay, how? Over the skin. So dermal patches. Okay, we can give. If there is A for agitation, if she is agitated, we will give her some calm medication. Okay, S for secretion, anti-secretory we are giving, right? Glycopyrenium, that one we are giving. So if there is any secretion, we will also treat it. Okay, if she feels any kind of sickness, that means nausea, we are going to treat that also. So this is the only pass. That's how I remembered always. These 4 only you can do in EOL. That's it. So in a nutshell, if you just explain it to the patient that what is the end of life care, it's a path, the holistic pathway to, we will try to make your life be empathetic, low down your voice, because this is cancer patient or cancer patient surrogate, cancer patient's son or daughter. So we will try to make her life as comfortable as possible. And we will make sure that the quality of life will be maintained. But I'm sorry, we are not going to do any aggressive intervention like any tube feeding or anything. Why, doctor? Why? Before that, if you have chance, tell them if there is any pain. Like if there is any pain, we are going to give her some painkiller. We will reduce the pain. If she's agitated, we will control it with some calm medication. If there is some secretion, we will treat it. If there is some sickness, we will treat it. Okay? Why no tube feeding? You are not a dead patient and you are, I mean, she's dying and you are making her starvation. I mean, you are just not letting her eat anything. Already she is not eating. So what will be your answer? Why no feeding? The fact is that obviously as this procedure, if we are going to do any aggressive or intervention right now, that will be not beneficial. In the best interest of his condition, we are going to give her some symptomatic management of life. But now, when at the end of the, but doctor, give her some food at least, give her some food. So when a person reached no food, when a person reached at the end stage of their life, they are not feeling their hunger anymore. So rather than spending their energy on eating or drinking, they are preserving this energy. Okay, but please be sure if he wants, definitely we will give him some palatable beverage or sip of water. So our team will take care of it. Please don't worry. So the fact is that at the end of the life, people are not feeling hunger anymore. Actually, they're preserving their own energy. So I can hold on in this world. Because even swallowing, chewing, that will waste the energy from. Okay. So this one, it's the best answer. If why no feeding, why at least give her some feeding. Okay. So that time, if yes, of course, if the patient wants, we will provide. Maybe we'll give some, after counseling with our SOLT team and our dietitian, maybe we'll give some palatable beverage or sips of water. Okay, that's it. So this is your feeding answer. How long going to die? Already I told you. Okay, so that one, if palliative, better to mention like weeks to months. And if it is EOL, that time mention days to weeks. And obviously the pattern is same. Give them some support at that same time, some supportive. Okay, that's it. That's it, I think. Anything. And that last but not the least, both the cases actually, also the last case, the palliative and this EOL, if you don't mention, even if you don't touch, be sure you will not get the full marks. Be sure about that one. Any palliative treatment, any EOL, you must ask about the advance directive. You must, and lasting power of attorney. These two a must to ask any cancer patient. Okay, so advance directive and lasting power of attorney. How he asked, Dr. Malik asked me, alhamdulillah. Okay, so now how you can ask the advance directive, that have you documented that how do you wish to be, if the patient himself, have you documented that how do you wish to be treated if the disease becomes so severe and you are unaware to take the decision? Okay, this is your advance directive. Have you documented it or not? Okay, then LPA, lasting power of attorney, have you nominated? So this one is the documented, anyone, and this one, have you nominated anyone? Lasting power of attorney. Have you nominated anyone to carry out your wishes? That's it, in a very simple language. Okay, so have you documented? Have you nominated? If like this third person, has your mother documented? Has your mother nominated anyone? Okay, okay, the question I will repeat again. So have you documented that how do you wish to be treated if the disease becoming so severe and you are unaware of it? The disease is so severe and you are unaware of it. How do you wish to be treated? The main portion is how do you wish to be treated? So documentation of what? How she is wished to be treated. Wish to be treated. Sorry, treated. And this one, have you nominated anyone to carry out the wishes? So to carry out the wishes. Nominated to carry out the wishes. Clear? Try to put simple English so that you will not, and this one, you need to memorize some, I told you, some words, some sentences. This will be khalas. You after just memorizing this, you know that if any palliative, if any end of life care, that will be so easy for you. That will be so easy for you. Okay, but this is a must. If anyone not mentioning this one, they must have lost their marks, both in 22, 23. Okay, in case 22, 23, both needed. If any cancer, already cancer patient, palliative, end of life care, this is the must. You need to finish your case with this. Even if you don't have time, I want to discuss about some documentation about advance directive and lasting power of attorney. We will discuss in the next meeting. Finish. If you don't have time to ask this both question, that you know that maybe your time is going to be finished, but let the examiner know that you know this too has to be asked. Maybe the concern were so much, so you didn't have the time. So even if you just ask in like this way, that I need to sit with you another meeting for some other documentation like advance directive and lasting power of attorney, khalas, you will get the mark. You will not lose it. Okay, clear? Dr. Raps, I have repeated that one. So I hope that you guys have got it. Clear? Any question from here? Any question from EOL or palliative care? You have to be very precisely differentiating between these two care. They want you guys to fail in this place. That should you give IV fluid, should you give oxygen? No, nothing. EOL means nothing invasive, nothing aggressive, nothing, no intervention. Nothing is there. Okay. Need to get DNR in EOL? No, DNR is another scenario. They will mention about DNR. Do not do resuscitation. Okay. That is in the different scenario. They will mention about in EOL. In separate, you don't have to mention about DNR. No need. But if DNR is another scenario, we'll do it inshallah. It will mention in the scenario to discuss about DNR. Okay, that time only DNR important. Other than that, no need. No need to mention about do not do resuscitation, because it is already, you have informed that there will be no intervention. So again, now DNR will take you so much time that if she fails, now you are making it more, inhuman for the patient's party, that if she's going to die even, then we are not going to give her, reverse her back. We are not going to give her any medication through the blood channel. This is, we are already telling that we are not going to give any medication through the blood channel, no tube. So DNR explaining, no need. No need. Already you have mentioned in the broad umbrella, we are not going to do any intervention. But specifically, if your scenario is DNR, Dr. Sampath, is it clear? Then please, that time only explain about DNR. Is it clear? Is it clear or not? Okay, thank you. Thank you. Any other question? Any other question, please? Welcome, dear. Any other question from anyone? Okay. So I hope that if there is any, because nowadays palliative and end of life care, they love it. They love it. And this drama, these things are repeatedly coming. So there's a high chance in the third diet also you will get it. So, and also I think it has opened, right? The third diet channel is open. And please, if you have, registration must be done, dear. If you are feeling that you are not ready, you will never be ready until otherwise you are getting registered. Okay, take my advice. The day you will get the seat, your preparation will start on that day. Other than that, you will just listen. You will just listen to all the free sessions, or maybe do some classes with the mentors. That's it. But your real preparation, it will start when you will register and get the seat. Trust me. So speak up, try to talk, try to do the cases, do mistakes, do the learning. With the mistakes we are learning. If you don't do mistakes, you can never learn. Never. PACES is not about getting silent. Okay, PACES is about talking. Most of here people, 80% people PACES giving, English is not their native language. Even for me also. Even my English is not good, I always admit. But using the simple sentence, simple word, make it a muscle memory, you can win the game. You just need to win the game. They will not assess that if your English is good or not. Some people, they are ashamed that maybe my English is so bad or I cannot make up the sentence. No, if you're not talking, how you will make up the sentence? Even they are not going to judge you grammatically. That is, are you doing the structurally, the sentence is grammatically correct or not? No, they're not judging you. This is not your IELTS. This is not about your English speaking test. This is about you are a safe doctor or not. Your clinical judgment is good or not. You are taking care of the patient's welfare or not. This is all about. Okay. So even if you are not good at speaking in English, we all, on 80% of us, our native language is not English. We are bad at English. Please. But still, admit it, do it. Even though you need to space, right? Welcome, dear. Dr. Rups, welcome. If you want to volunteer, whenever I put the date and time, please raise your hand. We will put the immediately your name. Okay. Thank you so much. That's the courage. Make the courage to, if you are not, just jump in the water, you will never learn swimming. This is like that. Okay. If you talk, that time only you will learn how to talk, how to make your sentence, how to make small Englishes like that. Okay. We all know, you guys are knowledgeable more than me, but speaking up, this is the important thing. Okay. Yes, Dr. Malikasuma, you want to tell anything? Anything else?
I want to volunteer.
You want to volunteer also? Okay. Dr. Hiva also, I think she always, she told me that she wants in every cases also. So let's see, inshallah. Whenever I have time, the date and time, please raise your hand and inshallah you will be included. Thank you. Thank you so much. Any other question, or otherwise I'm going to end this session. Okay. Thank you, everyone. Thank you so much. So we are going to end today. Inshallah, see you very soon. Thank you, dear. Thank you, everyone. Assalamu alaikum.